Heartburn, also known as acid reflux or indigestion, can cause an unpleasant taste in the mouth, a sore throat, chronic cough, or pain in the chest. It can be the result of a wide variety of foods and stressors. Being one of the most searched health-related queries on Google and YouTube, I thought it is necessary to discuss about acidity. Hello and welcome back to yet another important video on heartburn. The prevalence is as high as 40% in cities, where 1 in every 5 adults suffer from occasional heartburn, whereas 1 in 10 adults are on medication for the same. It can occur occasionally at all ages, but progresses to become severe in a subset of individuals. And you will learn why after watching this video. So stay tuned till the end. Heartburn is a feeling of burning in the lower chest with a bitter taste in the throat and mouth. It is usually due to regurgitation of gastric acid into the esophagus and is a major symptom of gastroesophageal reflux disease. In 1% of patients, it could be the only sign of a heart attack. It is surprising because heart attack symptoms and esophageal symptoms can be very similar, as a heart and esophagus have the same nerve supply. Reflux usually occurs after eating a big meal or while lying down. The feeling can last for a few minutes or even a few hours and usually relieves on its own, without any treatment on most occasions. When you eat, food passes from your mouth down a tube called the esophagus to enter the stomach. The food must pass through an opening through this tube. Usually, this opening closes as soon as food passes through. If it does not close all the way, acid from your stomach can get through the opening and into your esophagus. This is called reflux. Stomach acid can irritate the esophagus and in turn cause heartburn. So what are some of the factors which can trigger heartburn? Cigarette smoking, coffee, alcohol, soft drinks, certain dairy products like condensed milk, butter and cheese, chocolate, mints or peppermints, fatty or spicy foods, lying down too soon after eating, being overweight or obese, aspirin, steroids, calcium supplements and ibuprofen. With aging, changes occur in the ability of the esophagus to work smoothly. There is an associated increase in the occurrence of heartburn as one grows older. It is most common after overeating, when bending over or when lying down. Pregnancy, stress and certain foods can also make heartburn worse. So how do you recognize if you have indigestion? A painful burning feeling in the chest, often after eating heavy meals, going to bed right after meals, feeling full and bloated, feeling sick, belching, bringing up food or bitter tasting fluids into your mouth. Although, watch for other important symptoms like vomiting, throwing up blood, sudden pain in the chest, arm or neck, cold sweats, sudden loss of weight and appetite. If these symptoms are repeated or persisting, it is ideal to consult your doctor. To start, your doctor will review your symptoms and perform a physical exam. Your doctor may order tests to determine the cause. The tests can include blood workup, urine or stool tests, or an ultrasound. Sometimes the doctor will insert a thin tube with a camera called the endoscope to diagnose the cause, be it ulcers, erosions, gastroesophageal reflux, or even cancer. Most people who have indigestion lead a normal life. You might need to make some lifestyle changes to help prevent indigestion, or you may need medicine to prevent and treat symptoms. So let me share some prevention hacks for indigestion. To start, you need to know your body and how it reacts to different food and drinks. Spicy and acidic foods, chocolates, coffee and carbonated drinks can trigger indigestion. Some smaller meals throughout the day and not to eat too late in the night are good habits to follow. Do not lie down soon after eating. Limit the use of alcohol. Stress and lack of sleep can also worsen the symptoms. You shouldn't keep taking antacids or acid blockers regularly for long periods, as in the long run, they deplete the acid in the stomach, only to make the problems worse. Visit your doctor if you are on multiple drugs for various conditions like BP lowering medications, certain steroids and painkillers, as these medicines are known to cause or even worsen acidity. Lastly, let me wind up with some superfoods or home remedies which can be used to cure acidity and heartburn. Banana. It prevents acid formation. Cold milk helps to maintain the pH balance. Fennel seeds, it prevents bloating. Buttermilk aids indigestion. Basil leaves or tulsi stimulates mucus production in stomach, which in turn aids in preventing acid coming in contact with the stomach wall. Raw almonds neutralizes stomach acid. Ginger minimizes stomach inflammation. And not to forget, hydrate yourself adequately. Hope you found the video helpful. To continue receiving more such informative health and lifestyle videos, do like, share and subscribe to my channel. Thanks for watching.